You are watching Physio Guru. Welcome back to my channel. Today's topic: lateral epicondylitis or extensor tendinopathy. Introduction. Nowadays commonly termed as extensor tendinopathy, earlier this condition was known as lateral epicondylitis or tennis elbow. In this condition, there is micro disarray or can be said destruction of collagen occurs at the common extensor origin 2 cm below the lateral epicondyle. As this condition was also known as tennis elbow, there is a misconception that it only occurs in tennis players, but it involves other sports persons too, like swimmers, gymnastics, and baseball players too. Tendinosis of extensor carpi radialis brevis occurs. This muscle is mainly involved. Tendinosis means chronic degeneration without inflammation. It is more common in dominated hand. Now, what will be the mechanism of injury in this condition? First, repetitive microtrauma or can be say overuse syndrome, which is mainly seen in occupational reason. Second, minor strain or due to direct trauma. Causes. What will be the causes of this condition in a tennis player? First, if a racket is heavy. Second, recent change in activity level. Improper racket size resulting into weak grip of a racket. Change in technique. String tension. Faulty backhand stroke. Poor power or flexibility of muscles. Now, what are the occupations in which this condition is seen? In computer operators, person involving in tightening screws, wringing washed clothes, throwing sports, and the gardeners pulling weeds. And the other causes are inflammation of adventitious bursa, calcified deposits within common extensor origin, periostitis, simple or multiple tears in common extensor origin, angiofibroblastic proliferation of ECRB. Now, the pathophysiology behind extensor tendinopathy. It has 3 stages. Stage 1, acute inflammation but no angiofibroblastic invasion, pain during activity. Stage 2, chronic inflammation, some angiofibroblastic invasion, pain at rest and activity both. Stage 3, chronic inflammation and extensive angiofibroblastic invasion, pain at rest, inactivity, and in night pain too. Angiofibroblastic activity means there will be some disarray or destruction of the fibers of the muscle, mainly the ECRB muscle. The sign and symptoms. First, pain localized at lateral epicondyle. Lateral proximal forearm muscle pain occurs in repeated wrist and hand functions. Second, decreased muscle strength. Third, localized tenderness. Fourth, painful range of motion. Fifth, decreased grip strength. Now, what will be the limitations faced by the patient? First, inability to participate in provoking activities like throwing. Second, difficulty with repetitive tasks like using hammer or screwdriver. That's it for this video. For diagnosis and treatment, see Extensor Tendinopathy Part 2. Thanks for watching and don't forget to subscribe this channel.